Diagnosis in chronic kidney disease C.k.d. Broad examination for the calculation of the elevation of creatinine and urea, and also the other electrolytes like sodium, potassium, phosphate, etc., and also uric acid. Due to these elevation of the products and retention of water, the various symptoms appears, especially like edema, dyspnea, loss of appetite, loss of weight, and then reduction in the memory, intellectual capacities, etc. Next is the urine test. There is excretion of RBC, that is blood. Then there is excretion of uric acid. There is albumin, and also the glucose level is increased in the urine samples. So in urine, due to retention of the various electrolytes, the quantity of urine is scanty. There is excess of sugar, albumin, and RBC, and the other pathogen organisms. If they are responsible for this disease, they are also calculated, and culture sensitivity of the specimen is performed in the lab. Next is the series of X-rays, KUB, simple X-rays exposure to get films of the kidneys from various angles, CT scanning. Then the next is the ultrasonography, abdominal ultrasonography, and pelvic. They are also performed to explore the other pathologies if they are responsible for these symptoms. So in ultrasound study from external abdominal, we can also get the picture of the size of the kidneys, any pathology, tumors, lesions, and the mass, and also the structure and the ischemic process of the nephrons and the glomeruli. Next is the biopsy. By the needle biopsy, we get a piece of tissue from the kidney and sent to the laboratory for histological studies. And also the aspiration of the pleural and the abdominal fluid, that is in the case of pleurisy and the ascites, to study the pathology and the other causes responsible for this chronic disease. So these are the various procedures performed. Next is the treatment of the chronic kidney disease. The main cause of the disease is diabetes 2, and hypertension. So first, we should treat the patient, the diabetes, by anti-diabetic drugs and the anti-hypertensive drugs. They are given to the patient to control these two main causative factors. Then cessation of the smoking. Also, we perform the laboratory test for detection of virus infection, that is HIV, to treat the according to the pathogens or virus found. And the maintenance of the normal physiological weight, that is obesity. It is also a risk factor or the predisposing factor considered for this disease. So these are the guideline for the treatment of the chronic kidney disease, to check the reduce the progression of the disease and to give relief to the patient to lessen the symptoms of the disease. Although it is a incurable one and progressive one, but we can give relief to the patient by checking the progress and the rate of the disease and the symptoms, intensity of the symptom. We can also produce comfort to the patient. And last of all, that is when there are 3 degrees of the stages of the disease, that is minor, moderate, and severe one. Or in other words, we can also divide this classification in figure 1 to 5. So in the last stage, that is severe stage, or the grade 5th one, that is called as the final, that is the renal failure. Then we have to perform the dialysis. We have to wash the blood of the patient by the mechanical device to remove the excess of water and electrolytes, to maintain the physiology of the blood by this process of dialysis. But it is a temporary one. Final is to save the life of the patient is the most recent surgical procedure, which is called as transplantation of the kidney, which is successfully performed nowadays in all countries, whether they are developed and developing ones. So this is the only final treatment to save the life of the patient. Next is the prevention of the disease. Maintain the normal weight by exercise, and also to start the balanced diet, light exercise, walking, and we also reduce the quantity of water in this disease and the protein intake, and also the sodium potassium intake is also reduced. But as we know, there is inactivation of the vitamin D, so there is deficiency of the calcium in the blood in these patients, because the activation of the vitamin D is done by the kidney enzymes. So in this disease they are not available. So we have to provide the calcium supplements to the patient, and also due to lack of production of erythropoietin hormone by the kidney, we also provide injection of the erythropoietin and all the iron supplementation to the patient. And then limitation of the salt intake, sodium and potassium intake is also limited one. So these are the basic preventive measures to reduce the intensity of the patient and to give relief or to lessen the symptoms of the disease.